Hello, and welcome to Radical Chiropractic Company and Decompression. We specialize in helping people get long-lasting relief from bulging and herniated discs. We're able to help so many people with disc injuries because we utilize a DRX 9000 non-surgical spinal decompression system. Healing discs is what we do. We have a lot of passion for helping patients that are dealing with herniated discs because so often they've either been one, chewed out and spit out by the system that they thought was going to help them, or two, you don't want to suffer through the pain and expense and hopelessness that comes with a failed surgery or even with a successful surgery. So in the next few minutes, we're going to be able to explain how we've been able to help so many patients get lasting relief from bulging and herniated discs using the Spinal Decompression DRX 9000 system. So people with disc issues often try the least invasive, conservative treatments first. We're talking about chiropractic, physical therapy, acupuncture, massage. And as good as those treatments can be to manage your symptoms, often the disc just doesn't respond. Then they get an MRI and they find out they have a damaged disc. So after conservative care, what do we do next? Well, then you move on to pain management. This is injections, rhizotomies, ablations, things like that. And then you start talking about, well, should we consider surgery? How do you make the decision? Well, one of the reasons this is such a difficult decision for a lot of patients is that they have very little understanding of what's actually happening, what's going on. Once you do understand, things become a little bit more clear. So let's talk about it. Imagine you're looking down on the spine from the sky. This is the disc. It's got a hard cartilaginous outer layer. We call this the annulus. It's got a highly pressurized gelatin-like core called the nucleus. This is the spinal cord, and off to the left and the right come the nerve roots that go into your arms and your legs. And then this bump right here is what you would feel if you ran your hands down the back of your spine. So what happens is the cartilage of the disc weakens and the gel looks for a way out. And when it does that, it bulges through, invades the cartilage, and hits the nerve. And when it hits the nerve, that causes nerve pain and nerve irritation. Now you have to remember that this is a mechanical problem that requires a mechanical solution. And of all the treatments that are available, there's only two that actually affect the disc material. The first is surgery, where they just chop the disc material off. The second is non-surgical spinal decompression, which is what we do and our specialty. So a key thing you have to understand here is that all decompression is not the same. True non-surgical spinal decompression is not traction. A lot of patients are told they're getting decompression, but really what they're getting is traction. And there's a big, big difference between traction and non-surgical spinal decompression. So the DRX 9000 utilizes a logarithmic curve, and they have the only studies ever done that showed a real decrease in disc pressure without surgery using this logarithmic curve. The second beauty of the DRX 9000 is that its specificity. We are able to target a specific disc using the specific angle of the disc because we know every curve in the body has angles just like the rays of the sun. So at Radical, we're actually able to augment the angle of the pull to mathematically match the angle of the disc that we're targeting. This not only allows us to be super gentle and super effective, but it gives our patients amazing results. When we're able to target a specific disc, it allows us to create negative pressure inside the disc. This pulls the jelly back in from the outer rings and allows those broken outer rings to actually heal. This takes pressure off the nerve, allowing the relief of pain and other symptoms. So I proposed a treatment protocol that I felt was right for you based on the location and the severity of your disc injuries. I cannot promise that we will get 100% of our patients 100% better, but I can promise you that you will not find another doctor more committed to you not being forced to have surgery than me. If you have any more questions or concerns, you can always give us a call or text us. We will be here for you when you're ready to get true, lasting relief for your disc issues.